Hi, my name is Megan Dundas. I'm a veterinarian and the owner of the Lincolndale Veterinary Center, and I'm here to talk to you a little bit about dental care in pets. When dental disease is allowed to go on for a long time, you can go from a nice shiny teeth and a healthy mouth that looks like this to anything along these lines where you see there's tartar, the roots are becoming obvious and they shouldn't because the gums are receding. It can look like things like an abscess deep within the jaw, either on the upper jaw or the lower jaw, bad breath. If you happen to get a look in your pet's mouth and you see a canine tooth that isn't even in length to the other, that there might be a fracture there. You might even see things like pawing at the mouth, like it really hurts and they don't want to eat, or they might even cry after they eat. We see that more commonly with cats. Or you could see things like excessive drooling. That can also be a pretty good cue. Dental disease can be painful and it can affect a pet's quality of life and even the length of their life in the long run. Dental care is important for your pets because it helps extend their lifespan by minimizing ongoing infection. When there's tartar on the teeth and it sits right up against the gums, it can introduce bacteria into the bloodstream, and over time that will reach the heart and the kidneys and do damage if it goes on for long enough. It's also important because pets are programmed to mask pain, so they live with it. If they have a broken tooth, if they have sore gums, if they have loose teeth, they don't know that they have a choice in the matter. They keep eating, they keep functioning. And what I tend to see is that after we address dental disease, owners will say, wow, Sparky's back to who he used to be. I thought he was just getting older and slowing down, but no, he was really kind of living with oral pain all the time and just coping. So it's really rewarding to be able to address that and improve pets' quality of life. You can start dental care for your pet at any time. Ideally, the sooner the better. As a puppy, as a kitten, go ahead and get started. The earlier you get your pet used to you handling their mouth, having things inside their mouth, the better chance of success you will have. The key with brushing, which is best, is to do this at least every other day, if not daily. Once a week, once a month isn't really going to be worth your time. There are finger brushes that you could put on your finger. There are longer brushes for a bigger dog's mouth, tiny brushes for those tiny little cat and Chihuahua mouths. Many ways to go. Just be sure you never use human toothpaste. We don't want our pets swallowing fluoride. If brushing is truly difficult, impossible, I'd say first talk to your vet or a veterinary technician. Make sure that you're doing what you can to make it successful with your pet. But if you find it's really difficult, there are dental chews, a whole variety of dental chews to consider. There are water additives that will help prevent plaque, that soft material, those food particles from crystallizing into tartar. There are wipes you can use, all sorts of options. A website I love to refer to is called the Veterinary Oral Health Council. They have a list of products that have been tested and proven to prevent the formation of tartar and progression of dental disease. But really, brushing is best if you can make that happen. There is no one-size-fits-all plan for how often a pet's teeth needs to be cleaned. Genetics play a big role, what they're fed, their chewing habits, all of those things matter. And part of what determines that is how successful we can be with an at-home dental care regimen that you can implement consistently. Pets do need anesthesia for dental cleaning. This is necessary because it allows us to examine each and every tooth carefully, just as they would for you at the dentist. It allows us to x-ray the teeth, which is really the standard of care in veterinary medicine. We have no idea what's going on in those tooth roots unless we take an x-ray. It allows us to scale and polish those teeth, and that makes noise, it vibrates, it shoots water. All of these things are probably overwhelming for pets. They're scary, and some of these procedures, if say we're doing a dental extraction, it's painful, and we need to be sure that we're making this as safe and as positive of an experience for your pet as possible. There is a risk to any procedure performed under anesthesia. I have additional training in veterinary dentistry. We've had an anesthesiologist come in and consult with us on our protocols. We are taking steps to minimize those risks and feel that the small chance of there being a bad outcome for your pet is far outweighed by the benefit of addressing dental disease early. If you have any other questions, feel free to call us at 914-248-5050 or check out our website at lincolndalevet.com.